Your lower back has been hurting for months. You have stretched it. You have strengthened it. You have rested it. You have tried heat, ice, massage, physiotherapy. Some things helped for a day or two. Then the pain came back. Here's what nobody checked. Your pelvis is tilted, and every single step you take, every time you sit down, every time you stand up, you are loading your lumbar spine at the wrong angle. The back is not the problem. The pelvis is driving everything, and until that changes, nothing you do to your back will permanently fix it. I'm going to show you exactly what is happening, why your pelvis gets stuck in the wrong position after 40, and the 3 corrections that start working from today. Comment below. Does your lower back pain get worse when you stand for a long time or when you sit? And if this is the kind of honest health information you have been looking for, hit subscribe. Every week, I publish what your doctor does not have time to explain. Most people think of the pelvis as a static structure, a basin of bone that just sits there holding everything together. It is not static at all. The pelvis is the foundation of your entire spine. And like any foundation, if it is tilted, everything built on top of it is under stress. There are 2 directions the pelvis can tilt: posterior, where the bottom of the pelvis tucks under and the lower back flattens, and anterior, where the front of the pelvis drops down and the lower back arches forward. Both create problems. But after 40, anterior pelvic tilt is by far the most common, and it is the one almost nobody catches. Think of it like a building on a hillside. The foundation is not level. The building is not falling. It is standing. But every wall, every beam, every joint inside that building is under a load it was never designed to carry. Over years, things start to crack, not because of what happened to the building, because of how it was sitting on the ground. Your lumbar spine is the building, your pelvis is the foundation. When the pelvis tips forward, the curve in your lower back increases. The joints at the back of the lumbar vertebrae, called the facet joints, get compressed. The disc spaces narrow at the back. The muscles along the spine have to work constantly just to hold you upright, and the pain that results feels exactly like a back problem, because that is where you feel it, but the source is lower. Here is where it gets specific. Anterior pelvic tilt does not happen randomly. It has 2 direct causes, and both of them get dramatically worse after 40. The first is a tight iliopsoas. You heard about this muscle in the context of back pain. It connects the lumbar vertebrae directly to the top of the femur. When it tightens, which happens progressively with every year of predominantly seated activity, it pulls the front of the pelvis downward. The pelvis tips forward. The lower back arches. The facet joints compress. Think of the iliopsoas like a rope attached to the front of the pelvis. When the rope is loose, the pelvis sits level. When the rope is pulled tight from years of sitting, from progressive shortening, it drags the front of the pelvis down toward the floor. The back of the pelvis rises. The lower back curves increase. Everything on top shifts. The second cause is weak gluteus maximus. Your gluteus maximus, the large muscle of the buttock, is the primary muscle responsible for pulling the back of the pelvis down and keeping it level. When the glutes are strong and active, they counterbalance the pull of the iliopsoas and hold the pelvis in neutral position. After 40, 2 things happen simultaneously. The iliopsoas gets tighter from prolonged sitting, and the gluteus maximus gets weaker from the same prolonged sitting, because when you are seated, the glutes are completely switched off. They do not contract. They do not maintain strength. They atrophy quietly year after year. The result is a pelvis being pulled forward by a tight iliopsoas with nothing strong enough to hold it back. This is not a back problem. This is a balance problem between 2 opposing muscle groups, and the spine is paying the price. A 2019 study in the Journal of Physical Therapy Science found that adults with chronic lower back pain showed significantly greater anterior pelvic tilt compared to pain-free controls. On average, 7 degrees more forward tilt. And that correcting pelvic alignment through targeted muscle rebalancing reduced lower back pain scores by 52% over 8 weeks. 7 degrees. That is the difference between a pain-free spine and one that hurts every day. Here's how to know if anterior pelvic tilt is driving your back pain. You do not need a specialist. You need a wall. Stand with your back flat against the wall, heels, buttocks, upper back, and the back of your head all touching the wall. Now slide your hand behind your lower back. How much space is there between your hand and the wall? If you can slide your hand through easily with room to spare, your lower back is arching away from the wall significantly. That arch is your anterior pelvic tilt. A neutral spine should allow just enough space to slide your hand through with slight resistance. More than that, and your pelvis is tipping forward. The second check is even simpler. Stand in front of a mirror, side on. Look at your belt line. If the front of your belt is lower than the back, if your belt slopes downward toward the front, your pelvis is in anterior tilt. I had a patient, Carol, 48, a teacher from Denver, chronic lower back pain for 2 years. She had been told she had mild disc degeneration at L4 to L5 and was managing it with physiotherapy and occasional pain medication. When I assessed her posture, her anterior pelvic tilt was immediately visible, a pronounced forward arch in the lower back, tight hip flexors that limited her extension range, and glutes that were markedly weak on manual testing. We did not touch her back directly. We focused entirely on releasing the iliopsoas and activating the gluteus maximus. 6 weeks later, her lower back pain had reduced by 65%. At 10 weeks, she described herself as essentially pain-free for the first time in 2 years. Same disc, same spine. Completely different point of intervention. If this is starting to sound like your situation, hit the like button. It helps this video reach people who have been treating their back for years without anyone checking what their pelvis is doing. Everything comes down to restoring balance between two muscle groups, releasing what is too tight and activating what is too weak. 3 corrections, all doable at home. Start today. Kneel on your right knee, left foot forward in a lunge. Keep your torso upright. Do not lean forward. Push your hips forward slowly until you feel a deep pull in the front of the right hip. Not the knee, not the back. The front of the hip, deep inside. Hold for 45 seconds. This is the iliopsoas, lengthening. Switch sides. Do this once every day, ideally after sitting for a long period. Consistent daily practice produces measurable change in iliopsoas, resting length within 2 to 3 weeks. Lie on your back, knees bent, feet flat on the floor. Squeeze your glutes as hard as you can and lift your hips off the floor into a bridge position. Hold for 3 seconds at the top. Do not let the glutes relax at the top. Lower slowly. Repeat 15 times. This is not a general exercise. This is a targeted reactivation of the gluteus maximus, the muscle that is supposed to be holding your pelvis level but has been switched off by years of sitting. 3 seconds at the top is critical. That contraction at end range is what rebuilds the neuromuscular connection. A 2022 study in the Journal of Strength and Conditioning Research found that a 6-week glute bridge protocol performed daily produced significant improvement in pelvic alignment and a 44% reduction in lower back pain in adults with anterior pelvic tilt. 44%. From one exercise done consistently. This one costs nothing and takes no extra time. Every time you catch yourself standing, at a kitchen counter, waiting for something, in a queue, check your pelvis. Consciously tuck it slightly. Imagine pulling your belt buckle up towards your navel. Not a dramatic movement, a subtle repositioning. This is called a posterior pelvic tilt correction, and it takes the lumbar spine out of the compressed position it defaults to. Over weeks, as the iliopsoas lengthens and the glutes strengthen, this position will start to feel natural rather than forced. Your lower back pain is not a back problem. It is a foundation problem. Your pelvis is tilted forward, pulled by a tight iliopsoas, unsupported by weak glutes, and your lumbar spine has been absorbing that misalignment every day. Iliopsoas stretch every day. Glute bridges every day. Check your pelvic position every time you stand. Start today. If you want to know which specific exercise most people do to fix their lower back that actually makes the pelvic tilt worse and what to do instead, that video is right here.